RSV Academy. Questions about RSV. Which are the risk factors of RSV in children?
Hello, we now look at RSV risk factors for RSV infection in young children. So what do we know about the risk factors? Age is the predominant risk factors. Here on the slide I have two graphs, one from England, a study that was conducted over a 3-year period between 2010 and 2012, then a slightly longer study from Australia that was conducted, and both studies essentially show the same thing, that the peak age for hospitalization against RSV is in the first 2 months of life. So young age, very young age, is an important risk factor. The second risk factor is the relationship of birth month to the RSV season. So we all know that RSV tends to occur during the winter months. So in this slide over here, what we're showing is data from England, again for a 3-year period from 2010 to 2012, where the RSV hospitalizations, for those who can see the slides, they are in these blue bars, and then the positivity rate, the RSV positivity rate, determined by the data from both from the hospital but also from central surveillance, is about shown in the gray lines. And what we see is that the peak RSV positivity is occurring in the month of December, January, so around the week 51, 52 during this period. But when they were to look at the RSV hospitalization by the birth month of these children who were admitted to the hospital, then what they found was that the children who were getting admitted to the hospital were those who were probably born in September, October or November, not December. The likelihood of getting admitted in December was much lower compared to the likelihood of getting if you were born in October. So that is an important distinction. So if you are around 3 months of age, by the time the RSV season peaks, you are at a higher risk for getting admitted to the hospital. Then what are the other risk factors? And this is from recent updated meta-analysis that was done by our group and presented at the RSV Vaccines for the World Congress earlier this year. If you are a male child, you are much more likely to get admitted due to RSV. If your mother smoked during pregnancy, you are at a higher risk for RSV. If you are HIV infected, you are at a higher risk for hospitalization against RSV. Then other things like indoor air pollution, for example, low birth weight, so your birth weight was less than 2,500 grams, born prematurely, so before 37 weeks of gestational age, having a sibling under the age of 5 years, and having comorbidities like hemodynamically significant congenital heart disease, bronchopulmonary dysplasia, Down syndrome, or any chronic disease. All of these are important risk factors for getting RSV and getting hospitalized from RSV. Now, obviously getting admitted to the hospital from RSV can be distressing both for the child and also to the parents, but even more distressing is having some of the poor outcomes. And there was a meta-analysis that we published last year in the Journal of Infectious Diseases. This was work done by the Rescue Consortium, and where we looked at the risk factors for poor outcome from RSV. And the poor outcome is defined as prolonged length of stay, so length of stay more than 5 days in hospital. If the child needed to receive oxygen supplementation, was admitted to the ICU, it needed mechanical ventilation, and what we found was that if the child had a comorbidity or a congenital heart disease, then they were at least 3-fold more likely to get admitted to have and have poor outcomes compared to those who did not have these risk factors. Again, if the child was born prematurely, about the risk was about 2-fold higher. Of children who were born less than 32 weeks of gestational age are at higher risk compared to those who were born between 32 and 37 weeks. And then if you are a young child, as I said, that puts you at higher risk, not just for RSV, but also for poor outcome. But the important thing to note here is that it's not just being in the first 2 months of life, that risk for poor outcome generally extends to a slightly longer period. So even if you are less than 6 months of age, you are likely to have a twofold higher risk of poor outcome compared to someone who is 6 to 11 months of years of age. So what are then the risk factors for RSV mortality? Now, this is something that is much less well understood, primarily because the data are poor. It's very difficult to collect these data, difficult to follow up children who get RSV and then get some poor outcomes and then they die. And therefore, many of these data are based on hospital-based studies, but there's been some good work that's been done by tracking RSV deaths in the community as well, particularly in Zambia and also in Argentina. So I'm going to present from all of these studies that were done in hospital and also from the studies in Zambia and Argentina. Prematurity comes across as a very important risk factor. It's a consistent risk factor which is there. So if you're born less than 37 weeks of gestational age, you're about at a fourfold higher risk of dying from RSV. Then having a comorbidity places you at higher risk for RSV mortality. Now the risk can vary considerably. There are 2 studies that have sort of reported and looked at this, but very wide confidence interval. But important thing to note here is that the risk is high. Then if you had congenital heart disease, then you are more than threefold likely to die from RSV compared to a child who doesn't have congenital heart disease. Then if you were in the first 2 months of life, as I said, you are likely to get RSV, have poor outcomes, and also more likely to die. So compared to a child who is about 1 year of age, those who are less than 8 weeks of age, less than 2 months of age, are about 5-fold higher risk of dying. And then in this data from both from Zambia and also from Argentina, they have shown that poverty and associated overcrowding, so if you're living in slum conditions, that places you at higher risk. And again, these estimates are quite varied. One study puts it at a 2-fold higher risk, the other one says that you are at 17-fold higher risk, and the confidence intervals are quite wide. But the important thing is that poverty and overcrowding are important risk factors. Are they important risk factors in themselves? Possibly not, but they do affect your ability to seek care, to be able to go to hospital, and therefore that is what affects your likelihood of dying from RSV. So in summary, age is an important risk factor, particularly if you're younger than 2 months of age, for RSV disease, poor outcome and death. Age less than 6 months at the peak RSV season is is a high risk factor for RSV hospitalization. Then if you're born prematurely, if you are having underlying conditions, and those with congenital heart disease are at higher risk of RSV disease, poor outcome and death. And then poverty and overcrowding have been shown to be associated with RSV mortality outside the hospital. These data are based on studies that were conducted in the community in Zambia and Argentina. Thank you for your time.